attended the session by our guru. What I'm going to share is a continuation program of that, because the challenge which we face is when we upgrade or up our knowledge in terms of treating patients, and when we have when we meet up with difficult cases like genetic mutation, malignant condition, autoimmune cases, the pathway laid down by the master himself, where we need to go still deeper. And this is exactly what I want to share. I want to share that reaching the simillimum is as good as mathematical, because he was on the verge. My father was on the verge of reaching or making it easy to reach the simillimum, very mathematical, and that was through the mind of pathology. I'm sure many of you are aware of that. But the mind of pathology has been taken in different direction and understood in a vague format. And people are only running after delusion and finding out delusion. But there is a mathematics to it. There is a process to it. So what is that process is what we are going to share. And how do you use that process to find out a particular rubric is what we are going to share. And from that rubric, how to reach the simillimum is what we are going to share with clinical tips. So what do you mean by that? So when you have a case of eczema, when you have a case of leukoderma, you have a case of any lesion on the skin, what we say is, oh, he has a problem with integrity. But the integrity is a generalized term. There is something which is a broader term, which is the morbid phenomena, what is mentioned in the aphorism, that it's the morbid phenomena which takes creates that immunity or depletes that immunity, and then takes the body towards the disease process. But further to morbid phenomena is what is inimical to that patient, what is very important. So one is the integrity part. Yes, the skin is integument, skin is integrity, skin is relationship. This is what we know. So any breach, any irritation, any friction in the skin is going to cause skin disease, skin ailments. But how is that specific to that specific individual is what is going to take us to the finer tuning of the remedy. So if you have atopic dermatitis on your hands, on your face, on your legs, the overall cause may remain the same, but the location of that